Hi, everyone. Welcome to episode 3. This is a continuation of our conversation with Hanneke and Jim, the parents of Rebecca, a former patient of mine diagnosed with osteosarcoma at 7 years of age. She is now 4 years off of therapy in survivorship land. As part of our conversation focused primarily on survivorship, we decided to give you this as a separate short episode. Even though it's short, it's packed with some really relatable and important topics, including scanxiety, late effects, and letting go of your medical team as you transition into survivorship. I also wanted to update you all that Rebecca's 4 years off therapy scans came back showing no evidence of disease, which is awesome news. If it sounds like this episode ends a little abruptly, it does. I'm still working on my editing skills, so thanks to all of you for your patience as I become a skilled podcast editor. Enjoy the show. Hey everyone, we have to add in this part every time for the lawyers. The content that you're listening to on the Sarcoma Sisters podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. As you all know, we have the utmost respect for your oncology medical team, and we know that they know you and what is going on with your health the best, so we want to leave all those decisions up to them. Thanks so much. Hi, I'm Dr. Lisa Kopp.
And I'm Dr. Wendy Allen Rhodes, and we are the Sarcoma Sisters.
We are friends, moms, wine enthusiasts, and pediatric oncologists.
That means that we take care of kids, teenagers, and young adults with cancer.
We know that cancer is confusing and scary.
And our patients tell us that it's even harder to find information about sarcomas. So we are bringing the experts to you to talk about all the things.
Well, all the things important to you.
Thank you so much for listening.
All right, let's get started.
So tell us where Rebecca is now.
We are in a period of what's called scanxiety.
Tell us. Tell our listeners what that
Yes.
is.
So whenever you have scans, you start off with scans at the beginning. And I know that every protocol is different, but for different cancers, different sarcomas even. So we started off with all the scans, the bone scan and the MRI and x-rays. Sorry. And then, right before surgery, Rebecca had another series of scans. And then periodically, so at the end of treatment, obviously all the scans. And then her protocol is that for the first, I believe it's 3 years, it's every 3 months. And what happens as a parent is that, you feel like you're moving in the right direction, right? Like it almost sounds weird, but your kid is showing all the side effects of chemo. So they're puking and they're feeling bad. And it makes you feel like, okay, well, it's doing its job.
Right.
Rebecca even said that. So the day before her surgery, we had her scans way back when. And she had just had, I'm going to say 3 months of chemotherapy. And Lisa did this really great thing. So she had her two, I can't remember if it was the bone scan or the CAT scan, but you had two of them together and you could make them like 3D and rotate.
Oh, the PET CTs. Yeah. I would make everyone dance.
Really cute. Dr. Gere doesn't do that. Anyway, so Rebecca, I remember you showing her, look, this is what your tumor looked like then in September, and this is what it looks like now. And this is what the dark spot means, where before it was white. And you said, or she said to me, Mom, chemo really sucks, but at least it works. And, that was a huge thing for her. I mean, admitting that she doesn't like to complain. She doesn't admit when she's in pain or uncomfortable usually. So that was really big. But, so those scans, every time you have them, you're preparing for them. It's not like you have the scan and then 5 minutes later you get the result. You have to sit on it for a few days. And being in the room when she gets her MRI or bone scan or any of those other scans, you start thinking about all the ones she's had before. And you develop this anxiety. And because it's caused by the scans, we call it scanxiety. So we are in the midst of scanxiety. Rebecca had her 4-year post-chemo scans on Thursday, and we won't find out until next Friday, so more than a week later.
Oh, wow.
What those results
it's a
are.
long time.
It is a long time. But that's so far, cancer has not come back. So that's a positive thing.
I think it also leads to like wanting to be a mystic or divining things, because you watch the tech who's taking the X-ray and
look at their face.
Look at their faces and do they leave the room? Don't they leave the room? Did they call somebody? And you're trying to figure this all out. And I think there's and it may be completely misplaced. It may be true, but I think we've kind of developed this working hypothesis that if they give an X-ray and an MRI and then that's it. It's like, okay, see you later. Then that's probably an indication that things are okay. But if they go, hey, we need to take a couple more shots, so this is going to be a little while, then that's our indication to be nervous. I don't know if any of this is true. It's just how we've dealt with it.
Yeah.
It's not uncommon. I have definitely gotten calls from the radiology department from my parents. They're taking extra images. They made her turn this way. I think I see something. I mean, it's got to be just torture. I mean,
yeah,
you have a process and you're used to it. And if they're going in like this and then all of a sudden, and they start doing things different, and it could just be that technician's new or, doesn't know how to run that machine or whatever, but it does not matter. It still provokes these flashbacks of fear and worry and heartbreak. And it's so hard. I know it is.
I think if I remember correctly, your question was specifically how Rebecca is doing now. So one of the other things that you kind of gloss over in the middle of treatment is that big, huge stack of papers that you have to sign right before each and every chemotherapy or medication that your child receives. So you look at that whole paper and you see that there's a whole lot of little fine print there, and your brain can't process it because this is what the doctor told us that we're going to do. This is the protocol, so we're going to do it. So you just flip it over and you sign it and you figure I'll deal with it later. So now we're in that phase of we got to deal with it later. And that's, I mean, for us, because our situation is a little bit different, right? So we were treated in one country, and since then we have moved twice to 2 different countries. So we are dealing with not just follow on, but some sort of survivorship survivor's situation in 3 different countries. Now the protocol is all the same, thankfully, so that makes it easy as far as the oncologists all know what she has received. It's all familiar. So now you got to deal with a whole series of other doctors, so we got to see the cardiologist because one of the chemotherapies is really bad for your heart, and we got to make sure that your heart long term can do what it's supposed to do. You got to deal with endocrinologists. You got to deal with just a myriad of doctors. And I think that, so that's the situation we're in now, right? Trying to figure out, okay, so we made sure that she got the treatment she needed. How is that going to affect the rest of her life? And for Rebecca specifically, right? So it was a bone cancer. So, you're also dealing with, okay, now one leg is shorter than the other. And we got to talk about leg extensions, and we got to talk about problems with her ankle because of the difference in height. And there's just, I think when you go into treatment, you think, okay, we'll do it. We'll do exactly what the doctor says. And in 9 months, we're done. And probably because your brain can't process long-term, at least for me, I couldn't. You don't think about everything that comes after, and that idea of returning back to normal, you never get back to normal. The family that you had for us in August of 2015, that family will never return the way it was. And there are a lot of positive things in our family unit that have come out of this. But you also look and say, okay, well, Rebecca's going to have to deal with this for the rest of her life in some manner or another. just because of the side effects of chemotherapy.
So I would also say that there's two almost contradictory things that you have to hold in your head at the same time. One of them is exactly as Hanneke said, is that, Rebecca is dealing with this day by day, and she's dealing with it long term, and she'll always have to deal with it. And to have the proper sympathy for her, and struggle with that with her. On the other hand, and I don't say this lightly, these are good problems to have.
Yes.
The alternative is not good. So these are good struggles. These are good problems to have. I would never say that to Rebecca in those ways, yet I hold those two thoughts in my head at the same time. I'm happy that we have to deal with these things, because the alternative is horrible. So we I don't know if this is appropriate to say on a podcast, but we'll embrace the suck wholly and fully, and understand that these are good problems to have. And at the same time, we will sit there in the suck with Rebecca and understand that she's the one that has to carry this burden.
And I think it's okay, to honor both of those feelings, both of those sets, because it is still a struggle, and even though it's a struggle, of course, you're grateful that it's not the alternative. But I think it's okay to embrace that it's a struggle, and to honor that, that it is a struggle, and it's not something that people with healthy kids who have never gone through cancer have to deal with,
Yeah. And I think it's, I think year 1 looks different than year 5, and year 7 looks different. And it's, especially for kids that have cancer when they're very young, how they own or control the narrative of their story, which I appreciate that you've been very respectful of, Rebecca. And like you said, I'm not sharing a ton of her personal stories, because I think just what we're doing now, podcasting, social media, et cetera, I think it's important that we think about those things, especially for kids that are very young, that don't have control over their own narrative right now of how that story is told, and what that's going to look like when they're teenagers. I think those are all very important things that, up until even just the last couple of years, I hadn't really talked about a lot with my patients or my families, but I talk about it with my teenagers now, of like, this is your life, this is your body, it's your cancer story. The whole family goes through it, but we can talk. I can help you talk to your parents. Like, do you want a whole Facebook page dedicated to this? And some teenagers are like, no, ma'am, I don't want anybody to know this is going on. And that's okay. And so I think, as survivorship goes on, that looks very different, and it doesn't end when she turns an adult. These things will still continue to percolate and be a part of the fabric of her story and how that plays on. We never know how our kids are ultimately going to go on and be, but I think these are things we have to think about for kids going through these really hard things in the ever sharing world that we live in. Yeah. So survivorship is a tricky one. I tell my families this, and I don't know if you felt this, I always tell them as we're kind of approaching the end of therapy, like, it's going to be harder to stop seeing me. I bet you thought you'd never want to see me every week. But by week 3, you're going to be really missing me. And like, I just wanted to blood count just to see if it's okay. Right. Like I just feel weird. I didn't get a lab this week. And so that early survivorship is hard. And then it gets, it changes as it goes on. And,
I'm sorry. No, go ahead. For Rebecca, I believe it was relief. We have seen this through, and we had a countdown, and then now you've had your last cisplatin, and now you've had your last doxorubicin, now you've had your last methotrexate. And it was a countdown, and it was a relief. For me, I felt like all of my security that I had, it was like the floor had opened up underneath me, and I was now on my own, floating there. without having those weekly checks. And well, I think she might have a fever. What are we supposed to do now? Because usually you get right in the car and you go straight to the hospital, and all those questions and, then the scans and all the anxiety. But that whole support system is gone. All those people that you have relationships with, your nurses, your doctors, your techs, all those people who've become so important in your life because they're the ones caring for your child, they're all gone. And I remember that being really hard.
Yeah. Yeah. To clarify, my teenagers and my young patients never want to see me again, but my parents do. My parents are like, can we just check? Can we just check a blood count? And it is very hard.
Thanks for listening to our little extra bonus episode from our conversations with Hanneke and Jim. Thanks for listening. Follow us on Facebook, Instagram, and Twitter, or find us at sarcomasisters.com and drop us a note. If you enjoyed our podcast, please share with a friend. Thanks so much. Till next time.